focus of every healthcare provider should be to do what is best for patients. But getting to that best practice can sometimes be a challenge.
We can chat with them, we can talk to them, we can push out education, we can continue to connect with them and really start to let our patients know how integrated of a system we are, that we're going to be there when you're in our hospital, we're going to be there when you're in our medical group, we're going to be there, we're going to wrap around you with all of our digital services. I mean, I think that will be our differentiator in the future. That's what's going to change the care of patients.
That's Melinda Cooling, Senior Vice President for Advanced Practice Providers, and I'm Shelli Dankoff, your host for OSF HealthCare Accelerated. We appreciate you tuning in and remind you to be sure to subscribe, rate, and review wherever you get your podcast. In March of 2023, the Patient-Centered Outcome Research Institute, PCORI, named OSF HealthCare as one of 42 health systems nationwide to carry out a pioneering initiative to accelerate and improve the implementation of research results in clinical care to improve patient outcomes, the ultimate goal. As a participant in PCORI's Health Systems Implementation Initiative, or HSII, OSF HealthCare is bringing its experience and expertise in healthcare delivery to help develop and implement viable strategies to actively adopt new practices with a goal to cut the typical years-long lag between publication of research results that have been shown to improve patient outcomes and the widespread implementation of those practices. Joining me to talk about this exciting work are Dr. Mike Cruz, Chief Operating Officer for OSF HealthCare, Melinda Cooling, who is the Senior Vice President for Advanced Practice Providers and the Chief Clinician Executive for OSF OnCall, and Dr. Ralph Velazquez, the Chief Medical Officer for OSF HealthCare, in charge of clinical excellence. So thank you all for being with me. And this is an exciting opportunity and topic to talk about. I'm going to start with you, Melinda, because this goes back to 2022, actually, where we first got involved and started with this. Tell us a little bit of a history lesson.
Sure. So this actually started with some work around the hospital at home is where this first idea got invited when we were invited to talk to PCORI. And at that time, we were able to submit for a project at that time, and then they invited us to submit a full proposal to be part of the HSII. We were selected, and we were really excited about that as a healthcare organization to really work with our clinicians and be able to take the evidence that PCORI has through research and bring that into practice. So along with all the work that we do in clinical excellence, this is really important as we try to take our standardized medical guidelines and implement them into practice for the care of our patients.
So we've had a lot of time now leading up to this. So this is kind of a checkpoint a couple of years in. So Dr. Velazquez, from a clinical excellence perspective, why was this important for us to get involved in this?
Well, this is a part of the maturing of a healthcare system. We're becoming a larger regional healthcare system. It's important for us to work together. And as we have defined our goals of driving towards 5-star quality, this is a chance to bring evidence, to spread it amongst all of our markets, to help us continue to improve on care delivery for our patients. It's exciting to be able to work with other leading healthcare systems from across the country.
Let's talk a little bit about that 5-star quality. For people who aren't aware, who might be listening to this, what exactly is that and why is that so important?
If you look at 5-star ratings in healthcare systems, a lot of this work has been initiated by the Centers for Medicare Services, and they look at star ratings. Everybody's used to seeing star ratings, whether you're on Amazon or wherever. And they're looking at healthcare systems, looking at the quality of care that we're providing, how safe is the care, as well as what is the patient's experience in receiving care. And as we look at those ratings, we find there are opportunities for us to improve. We may have one hospital that is doing very well in one area and another hospital where there may be opportunities. Sharing the knowledge, sharing some of the best practices is something that we continue to strive to do across our system.
Yeah, one of the things the HSII participants, and I'll just read a few stats here, represent 800 hospitals serving 79 million patients across 41 states, including the District of Columbia. So that sounds like pretty good company that we are keeping with this. So what are some of the initial things we've learned from them and they may have learned from us as this process has started?
Well, first, a few comments. Although we're kind of newer to the game with PCORI and this work, PCORI has been around for quite some time. And actually, we've had an interest in being part of this more than 10 years ago, I would suggest. We weren't as integrated as Dr. Velazquez is saying, a system back then. We were individual operating units, hospitals, a medical group that was partly employed and partly not and independent. It was really hard to convene around the similar platform, whether it's an electronic health record, whether it's the analytics and the data and the science behind that, much less to scale projects effectively to get the outcomes. So PCORI has been around for some time. And I mean, I'm at least aware of it even in the early 2000s. We've talked about this before. So this is an opportunity with really excellent healthcare systems to put some of that, what you say, expertise, but it has to be scalable. So you would have to have a system that's integrated with the medical group, the pre-hospital, the hospital, the post-hospital system, and then to really affect the change where we can see those outcomes regardless of the diagnosis or the discipline. Those are some of the things we plan to bring to bear. And also with the electronic components, with our OnCall and our digital expertise that we've been finding and still building into, I'd say, over the last 5 to 7 years.
For sure. Yeah, I would just comment too that, the PCORI work, this is a great opportunity for us to learn from other people. And I remember sharing with Mr. Bob Siri when we were announced that we were part of this. He said, one thing that's really important, even if we're not able to implement everything, is to learn. If there's a great deal of learning where we can work with these other healthcare systems. And I serve as the PCORI lead, so we meet usually at least once a month, if not every other month, with other healthcare systems where they're able to share things that they're doing, and we're able to sort of garner their support and their ideas of what worked well in your organization and what didn't, and recognize where we're really strong and where we have opportunity.
Yeah, I think that's the great thing to recognize. OSF HealthCare is on this national stage with other people. So not only are we learning, they are learning and taking things from us, because everybody has something different to bring. But it is interesting because sometimes people may not think we're as willing to share information. Well, you do what you do, and so this is nice. Everybody is talking and learning. And honestly, that's the way everybody's going to improve, isn't it? And willing to share.
Yes. Yes, it is.
I think that's the only way we're going to get the outcomes we need to get today.
Yeah.
If a blood pressure changes or a sugar range changes to become a hypertensive patient, or now you're diagnosed with diabetes, if you don't have the capabilities to scale the operation to affect the change, you can't do it one patient at a time in 120 different offices. You have to bring some scale, some of the IT infrastructure, some of the connectivity with the APPs and the doctors and the nurse clinics. And then we have to use a digital apparatus to engage those who prefer engagement in a different venue.
I get the sense you want to add something.
I think it's part of our DNA. I mean, we have been involved with the Institutes for Healthcare Improvements for over 25 years. And that's a collaborative of large systems coming together to improve the quality and safety of care. PCORI is just another extension of some of that work that we've been doing.
Now, Melinda, you alluded to this, that the HSII gives OSF HealthCare and other systems, perhaps financial backing or encourages projects to help learn from. So what were some of our identified ones, and how have those proceeded?
Yeah, so the first thing that we did was what they call capacity building. So they're trying to prepare organizations. What kind of infrastructure do you need to make sure that when you get to implementation projects that you can actually implement them? So we've really spent this last 9 to 12 months working on the capacity building piece. And we did an organizational assessment so we could identify where do we feel like our leaders and executives are at understanding PCORI and sort of evidence-based practice. That was one of our pieces of that. We've also started to work on the IT infrastructure of things that we need. So I'll use the example of REDCap, which is a very well-known research tool and survey tool. Bringing that into the organization, not only will that be important for PCORI, but also our Cancer Institute. I really feel like that'll be a game changer for them, and sharing our data with other organizations across the country. And then working on education to start to educate our mission partners about PCORI, evidence-based practice. How do we roll these guidelines out? How do we do implementation projects to not only just put them in place, but sustain them?
So we've done kind of the preliminaries now.
Right.
is the next phase to move into, here we are, boots on the ground, we're ready to go?
Yeah, so they actually, PCORI just released their funding opportunities, and one of the areas that we're really interested in is around hypertension. So we have some maturity in this space because we have the medical guideline that's been developed over time, and we've been able to educate on that with primary care and across digital and inside the hospitals as well. And then we have the digital infrastructure through OSF OnCall with some of the remote patient monitoring. So I feel that this could be a really successful project for us. So we plan to write for that for funding. And usually these projects are funded somewhere between $1 and $5 million or $5 million. So not insignificant funding for these opportunities.
So I'm going to put the two doctors on either end of you. What excites you about that type of, now you've done the preliminaries, here's the boots on the ground, we're going to implement that. As you hear that from the physician perspective, what do you think?
I think it's exciting to be able to, as Dr. Cruz mentioned, translate things in a much faster manner. And that's the enablement that electronic medical records do. At the point of care, there may be prompts that help me remember something that I just read last night or 2 nights ago, but there's so much information coming at me. So how do I keep that in front of people to help them make the right decisions at the point of care and at that time? And patients may come in nowadays with information from the internet or what they've read or what they've heard. But this is also helping our physicians and APPs keep up with it, putting it in front of our nursing to also help with the education, because sometimes there's education elements that have changed a bit from what our old beliefs were to what science is now and the evidence is now pointing towards what is the best practice. So it's exciting to have that availability and right at the fingertips.
I think what's really exciting is our ability to bring all these pieces to scale and really scale it so that we can impact the most patients. And so hypertension might not appear to be a super exciting diagnosis in and of itself, but it is extremely important because we think the impact to the kidneys and to the brain and to the heart over a period of years. We know now that how important it is to control that. Now, there are ways to avoid it, and there's people who are genetically handed a tough hand. So we have to be able to incorporate strategies to address all. And then how do you do it at scale? So you have nurses, you have algorithms. We standardize what's standardizable and nothing else. But how do you scale that across 51 counties and 80 or to 90 primary care offices, right? Because left to our own devices, there's a fair amount of variance in how we can handle high blood pressure. So something as routine as that there's parts that can be standardized. And then we have to take the patient into account and the variables involved, the abilities to pay for some of the medications. And then we need to have the expertise. So we have hypertensionists involved in those algorithms, working with the primary care docs and the cardiologists and the FAD practitioners and the internists and the APPs and the nurses who work in those settings to say, this is what we agree to. How do we make it easy, as Dr. Velazquez was saying, to do that work almost more instantly and as opposed to reactionary?
A number of the communities OSF HealthCare serves are rural. And so it's one thing if you're in a big urban area or a more urban area to have access to care. Will projects like this help some of that in our digital space, in our primary care offices to make that connection? And to your point, make the care equal across the continuum, if you will, and as much as you possibly can. Will this help, that type of thing?
I feel it will. I mean, I think when you think about the digital components, even thinking about some of the large healthcare systems who have implemented similar things in Ochsner, some of Mercy's hospitals, really having the digital piece in conjunction with the in-person care. So those patients in rural areas aren't expected to go into a practice all the time, but they're able to do remote patient monitoring. We can chat with them. We can talk to them. We can push out education. We can continue to connect with them and really start to let our patients know how integrated of a system we are, that we're going to be there when you're in our hospital. We're going to be there when you're in our medical group. We're going to be there. We're going to wrap around you with all of our digital services. I mean, I think that will be our differentiator in the future. That's what's going to change the care of patients.
I'll put it out there for final comments from all of you. What excites you most about this moving forward, and what should we look forward to in the immediate future? I'll start with Dr. Velazquez.
It's exciting to work with a national initiative and working with such, well-respected health systems throughout the country and being able to share with them and realize we're at the grown-up table now.
Yeah, I would share similar sentiment. We have a really strong PCORI team that works together on a routine basis. And then the support of our executive leaders, we use our leadership structure to really bring these ideas forward for them to help support us, including Dr. Velazquez and Dr. Cruz. But really bringing this to the organization, taking us to another level, providing care in a different way. And most of all, the most important thing we do is take care of our patients. And if we can change the outcomes for our patients and we can provide care for them, and they see that through our mission and vision of OSF HealthCare, to me, there's no better place to be.
Yeah, I would say the ability to really elevate the outcomes. So it's one thing. I think we do a really good job of taking care of people with blood pressure and diabetes and respiratory, so around blood pressure, but how do you become great at it? Really control what we can, because we know what happens if we control that over the next 20, 30 years. If we can live life better until your natural end, then these patients, yes, we can dialyze you, yes, we can do bypass surgery, and yes, we can drain an intracranial hemorrhage, but we can also avoid some of that by being better blood pressure control managers across a very large system.
Well, as the name of the organization we're working with says, Patient-Centered Outcomes Research Institute. Be listening for that, much more to come on it and the exciting things that lie ahead. Dr. Mike Cruz, Melinda Cooling, Dr. Ralph Velazquez, thank you so much for being here for this discussion. And thank you for joining us for this edition of OSF Healthcare Accelerated. Remember, you can dial in online for any of our past episodes anytime by going to osfhealthcare.org/accelerated.